Have you had nagging knee pain that you've learned to ignore or has been affecting your life? Hey, I'm Robbie Stahl, also known as the Fitness Doctor, the world's leader in anti-aging fitness. I am so excited to be coming to you this week with an interview with one of the industry leaders in knee health to help you, Dr. Trent Nessler. Dr. Nessler's work has influenced treatment strategies for thousands of patients. He is a true pioneer in ACL rehabilitation and knee health. He's the go-to authority that even the pros and orthopedic doctors rely on for the most advanced knowledge for helping individuals just like you have the best knee functionality. But what really sets Dr. Nessler apart and why I invited him to meet with us and you is his approach isn't just about rehab, it's about prevention and optimization. In this interview, he shares tools you can implement right away for better movement and health, how to identify risks early to save you from pain and costly treatments down the line, which you don't want any part of, and cutting-edge techniques that are shaping the future of how functional you can be and how great of life you can live. Plus, how you can apply all of this to your everyday life for anti-aging purposes. Before we get started, go ahead and hit that subscribe button below so that you get access to all of our best information and all of our industry-leading doctors to make you the very best functional individual. And with that, let's get into the interview.
Hello, wonderful to see each and every one of you here for the Fitness Doctor Coaching Show. And we have a very special segment, and you may have heard this saying before or not, but this gentleman, this brilliant doctor, who happens to be a very close friend and collaborator with me, is a brother from another mother. He is absolutely amazing. I've known him for well over 20, I think 23, 24 years. We are first great friends, and his wife, interestingly enough, worked in a medical office and a dental office with my mom. She was the office manager, and his wife was a hygienist. That's how we actually originally met. And then my mom and his wife would share stories about, the great work we're doing within our fields. And then they're like, why don't you guys meet? So we met for breakfast one day, and we immediately became best friends. We've been great friends for the last 20 plus years. And he is brilliant. He's done things like he 6 months dissecting cadavers just to better understand the core and the functionality. And he did that with one of the best sports medicine doctors and professors in the world. He's developed a 3D movement analysis system to analyze every little motion and movement and how fast the body goes into misaligned positions. He understands things that even the best orthopedic doctors in the world, like 99% of them, don't really understand or have the capabilities to do and instruct improvement of at the level he has. He's worked for a $7 billion company, healthcare company, as the sports medicine innovator. So this guy is absolutely amazing. He's a great friend of mine. We share a common interest in training jujitsu and martial arts. And let me bring him to the stage with us so that he can say hello.
Robbie, thank you so much. And you are so kind. It's one thing you left out of that. We went to the same high school. So and I'm super excited to be on here, especially with you. I've shared with you throughout our careers how much I've admired everything that you're doing. How you're reaching out to people, how you're changing people's lives. And now seeing what you're doing on such a large scale is absolutely amazing. So just really excited to be a part of this series.
Trent, and I have to say back to you from my heart, thank you so much, because I'm known in the field as a leader in the space of like neuromechanics and retraining and anti-aging fitness, but I actually have to give some of that or a significant amount of that credit to you, because of some of the most brilliant things that I know are actually from you as a mentor. Don't want to put you on the spot here, but you're a few years my elder. And
A few. Thank you.
So
I'll take it.
I've learned so much, and then the things we've built together. Just so for everybody that's not familiar with the work that Trent and I have done, or Dr. Nessler and I have done together, he's a good friend, so I'm going to call him Trent.
Please.
He has zero ego, so you could call him Dr. Nessler, Trent, whatever makes sense for you as our audience member. But we've developed some of the best like body mechanics optimization systems because of the research he's done, and then we've leveraged into the VIP training system. So like if you're a VIP, you haven't seen a lot of Dr. Nessler. As you start to get into our more advanced training systems, there are some pathways where you end up learning about him and the work we've done together. But he's been an integral part of the fitness doctor, and he's kind of like behind the scenes on the science side. So let's get into the meat.
Yeah, and it's been a fun journey. It's been a fun journey, and to go to our topic today, obviously we're talking about knees, and that's been a passion for me for, decades, 2.5 decades. So to be able to sit down and talk knee stuff with you is pretty exciting for me.
For those of you who aren't familiar, we just finished a back fixing product together, and we're in the forefront, the very forefront, the infantile zygote stage of developing a knee fix system that is going to be like a standalone specific to the knee functionality. Back fix is on the editing table. Right now it's in the development stage. So we're about to start a knee fix product, and we're really excited.
As you know, I mean, I've been doing a lot of research related to how people move, how that impacts loading of the limbs, and specifically the knee. And the majority of my work really started around ACL injuries in young athletes. But what you see is that over time, those same biomechanics apply really across the spectrum. So to be able to bring things like that knowledge, like that, really, quite honestly, that's part of what it comes down to, is giving people knowledge. That's what this is all about. Giving people knowledge and understanding of why you're doing the things you do. To me, is just, I absolutely love that. I love being able to do that on a large platform to really help to educate people, because people just assume, that they have to walk around with these pain and this limitation because we're maturing. I don't say aging, I say maturity, because I'm over 55. So I can say maturity because I'm doing nothing but mature. So all of that said is that there are solutions, there are ways out there to really keep yourself going.
Yeah, and that's one of the things that really fascinated me when we started getting into the work together. So for those of you who don't know, my first 10, 15 years of my career are focused, like Trent has, in elite high performance athletes and bodybuilders, and like taking people that have no business even looking at a muscle magazine, let alone being on one, and actually getting them on the muscle magazine. And that was fun for my younger years. But for me, I only stayed interested in like building people's biceps for so long. But if I could help people live longer and thrive more in life and like get more quality of life, that's the thing that really interested me. So when Trent and I started really digging into the research, it was basically came down to this, and this is how I see it, is like, as an athlete, the misalignments or lack of proper functionality, for simple terms, in the body as an athlete might mean that you cut on the field and you tear your ACL. But for a recreational exerciser, someone that's really wanting to live the most functional life, that leads to degenerative joint disease. Maybe not as likely, the ACL tear can happen for you too, but more likely degenerative joint disease, osteoarthritis, pain, stiffness, dysfunction, and or just feelings of aging. So the same thing that Trent is going to get into in terms of the science and the mechanics of the body, all of these things translate specifically also to you in your 50s, 60s, 70s, 80s, and even beyond.
Absolutely. And I think, one of the things that you really highlight a lot, and that is the importance of movement. And it's interesting to me because I am, I'm an educator for my profession. I do a lot of courses for my profession. One of the courses I'm teaching on is a movement-based approach to ACL rehab. So something that's been as well researched as ACL injuries, ACL rehabilitation, and the mechanics that are all associated with those types of movement patterns and things like that. Is that the knowledge around how movement affects that is still not quite there, let alone how movement impacts us as we mature, as we get into our 50s and our 60s, and how that affects your hip joint, how that affects your low back joint, how that affects your knee joint, and how all of those things are related. So, this is where things like this, hopefully somebody hears this, they watch this, and they walk away and they go, that's why my knees hurt.
I love what you just said. So let's make that. So let's make sure that you, as our attendee of this session, let's make sure you walk away with what Dr. Nessler just said. And that's like, man, I have massive value. So I think a good place to get into that is when I first started really diving into this work with Dr. Nessler, my thought was like this, everybody should do an exercise for a specific reason. But if you go to a gym and you look at like 99+% of people, and I do mean trainers too, and even physical therapists, many of them fall into this category. Why are you doing that exercise? Like, do you even know why? It's like, well, because from Arnold Schwarzenegger days, it said it would build my legs and my butt. And Yeah, but there's so much more to the functionality and the specifics. So it started with everyone should do an exercise for a reason. Then I came up with this idea that like, well, our goal should not actually be, from my perspective, for anti-aging, live the best life. It should not be for performance and it should not be for body composition. Yes, we want you to perform really freaking
Yeah,
well.
sure.
And we want you to look amazing, right? Trent and I are both obviously muscular and lean and athletic. So obviously we enjoy getting those kind of results. But if we lead with optimal functionality, or what I call and have coined in the fitness doctor, biomechanical optimization, that's really where you get the best results. So when Dr. Nessler and I started talking about these things, he's like, really, each segment of the body really has its own biomechanical optimization specific needs. And then we started developing systems around like, okay, optimal feet ankle function, optimal knee function, optimal hip, optimal pelvis, optimal back, and then optimal how it all ties together for like the what we call the kinetic chain or the core, which goes from the knees, right? You may all have heard core before. Like a lot of trainers might think that means like the abs or like
Sure.
ab muscles. Well, what it really means, right? What does it really mean, Trent? What does the core really consist of?
But it's really anything from the knee up to about, well, your shoulders. They all have some form of play on stability of your pelvis, stability of your lower limb, um, position of your center of mass. So I talk about center of mass. All I simply mean is upper body, and where that lands in relation to when you jump off something or you're walking. All of those things which affects ground reaction forces. It affects how the limbs are loaded. And so for me, the core is really, it's so much more complex to put a number of muscles to or specific examples to, because it really is, everything from the knee all the way up to your shoulders, because they all have some form or fashion of an anchor or a pull in providing some form of stability. It's also neuromuscular. There's that whole neuromuscular training component of it. You can be strong, but you may not be firing right. So like, how do you make it fire right? All those things. So one of the things that I mentioned is where your upper body or your center mass is in space and how that affects what are called ground reaction forces. So if I jump on the ground, there's amount of force that my body must absorb. And if, like in your car, your shock absorbers are super duper tight, super stiff, like you feel everything, like it jars your whole entire body. And then the other end of the spectrum is your shocks are too loose, and like you're still feeling everything because your body's moving all over the place. The optimal shock absorber is one that is moving some, but not too much, and makes the whole system stable, so that when you have those forces going through your body, is that not specific joints are not taking too much stress. For example, there's if you watch some people walk, and my wife and I always used to do this when we go to the mall, and she'd be in the store and she'd be in there forever, right? So I'm sitting out in the mall and I'm watching people walk. If you watch people walk and you see people whose hips move a whole lot, well, that's not good, because that's too excessive of motion. That's like having those shock absorbers in the car that are totally not working, right? So what that extra movement does is that the force that her body's absorbing every time they take a step that's providing excessive force, maybe to their hip or to their low back or their SI joint or to their knee joint. So having good stability, having some movement, but stable movement, really helps the body absorb those forces that we're going through.
Next, let's talk about a really interesting subject, and that is how knee pain, because most people think like knee pain, it's in the knees. Like they'll talk about like knee strengthening exercises.
Right.
And yes, that's important. Yes, for everyone. But when people really get into knee strengthening exercises, I'm always like, I feel like in sports medicine, I feel a big disconnect, because I feel like they don't really understand how the knee really functions, because knee strengthening is really important to a degree. And then there's some other things that become even more important. Let's talk about that.
Yeah, Robbie, and you're spot on, because and this happens a lot in the physical therapy profession, where somebody will come in and they start having medial joint line pain, for example. So their medial meniscus is a little bit irritated. And, in normal day life, your medial meniscus should not just all of a sudden flare up. It's not like, unless somebody came and hit you in the knee or something along those lines, but just walking along, you shouldn't just all of a sudden your knee start bothering you. And there's a concept that you and I have shared around root cause, getting to a root cause. What is the root cause of your meniscus hurting? Meniscus shouldn't just start hurting. you shouldn't just start having medial knee pain. Why are you having knee pain? Outside of a fall or something like that, why are you having medial knee pain? Could be simply that something is easy as changing your shoes, because maybe your arch is collapsing every time you take a step, which causes your lower leg to kind of turn in a little bit, which causes your knee to kind of go in a little bit, which places a lot of stress on your meniscus. So maybe it's something as simple as getting some foot and ankle exercises or strengthening, and having good shoe wear. Maybe it's something as simple as I'm in the kitchen, I'm standing up and doing dishes and I'm cooking dinner and my knees really hurt. Well, unfortunately, over time, as we mature, our tissues are not as resilient as they used to be. The meniscus is not as thick, it's not as resilient. And therefore, when we have things where we're standing for long periods of time, sometimes we need to wear shoes. Especially if you're doing all this in your kitchen and your kitchen has hard tile, then maybe it's something as simple as wearing a supportive, I'm saying the word supportive, flip-flop or tennis shoe, something that gives you good arch support. Because maybe it's that your arch is just collapsing. Because, ladies out there, unfortunately, one of the things that happens as we mature is that we lose elasticity in our soft tissue. What that means for you is that you might see your foot grow. Your foot's not actually growing. It's not growing in your 50s and your 60s and your 70s. What's happening is that the collagen on the bottom of your foot is not as resilient as it used to be. So your arch is collapsing. So as your arch collapses, it spreads out your foot a little bit more. And sometimes that can be the difference of a half a size in your shoe. So maybe it's not necessarily addressing your knee, but maybe it's addressing what you're wearing or putting on your feet and giving yourself a little bit more arch support. And you might find, if you are hitting that root cause, that, oh, you know what? Forgot to tell you about that foot pain, but all of a sudden that seems to be resolving too, and my knees feel better. So, I think part of it, Robbie, and that was a long-winded piece to it, but to me, it's really about finding that root cause, because we can go from the foot and we can go up to the hip and we can give you a lot of things there too. But I use the foot because that's the one that people so often forget about, and it's a common issue. Your foot is going to, unfortunately, as we mature, we lose water. That means that your spine starts to compress a little bit, which means that you can lose some height. And it means that you're going to lose elasticity of your foot, which means your arch is going to collapse, which means for ladies, your shoe size may grow a little bit. And I say, the only reason I say to the ladies, because guys don't usually recognize it. Ladies, because they're wearing, maybe more pointed shoes, you're going to definitely feel it quicker than a guy's going to feel it in a tennis shoe.
Yeah, the foot is so important, right? Because ground reaction forces begin there. So if we have a foot falling in, the knee is very likely to fall in. And as we age, that's even more likely to happen. And then for the ladies, once again, we have an increased Q angle, which basically means the pelvis is wider in a female, going down at an inward angle to the knee, which is like the number one thing that causes knee issues. So you have the foot mechanics affecting the knee falling in, but then also Dr. Nessler, Trent, let's talk a little bit about the hip and how the hip mechanics can affect the knee.
Yeah. Robbie, a couple of things that, and especially for females, females are more likely to develop some of these knee pains and problems. Part of that has to do with the Q angle. Part of it also has to do with how the force is distributed to the knee, because as a result of that Q angle, there is a smaller ACL in the female knee than a male knee. There's also the notch at the end of the femur is shallower in a female than in a male. And so there's things like that also contribute to that. At the same time, the glute medius. I mean, I talk a lot about glute medius, the ability of the glute medius and the external rotators to stabilize the hip. Hip motion is absolutely critical. One of the things that we do in our work is we've measured pelvic motion on over 90,000 people. And one of the things that I will tell you is, because of if this is my stance leg, if my pelvis is moving like this is moving my center of mass. Now, one thing that, in addition to what it does for your knee, is that if your pelvis falls this way, the center of mass moves this way, people are more likely to lose their balance. That actually increases risk for falls, and that's huge. If their pelvis goes this way and their center of mass now goes this way, that can actually drive a force vector to make that medial knee pain even that much worse.
Trent, if I can interrupt you just for a second, could you show us a physical representation of what you're talking about?
Yeah, for sure. And it's sometimes it's hard for people to see when I talk about this stuff. What I'm going to do is forgive me as I move my camera. So when I'm standing on one leg right now. Okay. So when I talk about position of the pelvis, one of the things that I'm doing here is I'm moving into that one position where I said our center of mass goes this way. And this is going to increase my the force at my knee. It's going to drive the force through my knee. Now, on the other hand, when I'm walking, if my hip drops this way a lot and my center of mass goes this way, this is going to increase the risk for me stepping down and losing my balance. So it's really that pelvic motion is really important because the other thing that we're measuring with that, Robbie, is how fast does it fall? The faster it falls, the worse it is because the faster it falls, the more likely you are to fall, number one, and the greater the stress is at your knee. So, we talked about core, core is a part of that, glute medius is a part of that. And then obviously, getting that neuromuscular activation. And then I know that you also talk a lot about, the mind body connection.
Yeah, the mind body connection is huge. And the way I see that is really there's the neuromuscular mechanics, right? The way your motor control systems and the higher centers of your brain are connecting with the body and understand motor mechanics and positioning, as Dr. Nessler was just explaining to you. But then there's also the emotional, limbic, somatosensory side, which as we age, we start to actually lose that mind-body connection. Neural connections go down. So you have both the mechanics, plus you have like, I'm aging or likely to have had past issues. So that equals trauma. So those traumas get held into the tissue and it like no longer is just physical. It's also emotional aspects as well, which presents things like what's called kinesiophobia or fear of motion and movement. And we really have to, when you start learning these things, our valued attendee here, you really need to learn like how to retrain your mind with your mechanics first. And I think the thing that really gets in the way for so many people is they think like workout, right? And you're not going to work out like Dr. Nessler and I. You need to start improving these things by very low load, no load, body weight, and like feeling the position, feeling your posture, feeling your alignment, and really focusing on your movement and the alignment of your pelvis. So a lot of what Dr. Nessler was just talking about is pelvic stability, having good pelvic stability, which enables the hip to function well. And then if you have good foot and ankle stability and have proper mobility, now you start getting all these parts moving in the right position so that when you do movement, the muscles in the place that really need to take and execute load and force do, and you save yourself the negative results from exercise. But the other thing that I would add is so important is the way you talk to yourself and the way you perceive your exercise and your loading, which is really so very important. Because when you exercise, part of it is the mechanics, but part of it's the way you're thinking and feeling about yourself and the motion and the movement, because our limbic system gets tied in. So our emotional aspect of our motor control system also gets tied in. So if you want amazing exercise results, you need to focus on alignment, feel and focus on the sensory perception of what's happening, and then also find the most comfortable, feel good emotions and self-connection. And when you do that, you're literally retraining your nervous system for proper function alignment and retraining your emotional system. And when you do that, your entire physiology and your biomechanics improve as well.
And Robbie, to build on that, what I will tell you is that people who don't have that, who have that negative mindset, for lack of better terms, you're talking, 2 to 3 times longer from a rehab perspective. We see it in here all the time. I mean, if you've got a person who is constantly, this is going to hurt me, this is not good for me, this is going to make me more painful. If that is always the mindset, then that's always going to be the result until you get them by baby step, and that takes a lot longer to get over that process. So to your point, getting that proper mindset is absolutely critical, and it's actually something that is so strongly associated that I talk about it in a lot of my courses on ACL rehab, and really we call it sport locus of control. Is giving the person the control back, giving them their control over their destiny. That's what I always say to an athlete is I am giving you control over your destiny. I can tell you exactly what's going on and I can tell you how to get over it. But 3/4 of the game is above the shoulders. It's not in your knee. It's not in your back. It's above the shoulders.
I couldn't agree more, my friend. Yeah, exactly. And then when we start looking at the research of interoceptive focused exercise, so you have everything from mental rehearsal, psychological research, where you're rehearsing the actual movement and mechanics and seeing actual physical performance improvement without actually doing the physical thing. So that's proven, by the way, ladies and gentlemen, on the psychology side. And then in the biomechanics side, it's proven that if we really take the proper deep interoceptive approach, research has shown as much as 20 to even 60% more improvement in your mechanics, because you're so deeply connected with mind body that you're getting more neural activation without actually having to increase loads yet. So what most people do in fitness is, how do I get stronger? Increase more, add more weight, lift more weight, which enables you to what? Turn on more muscle fibers. For example, if I do a curl, right, you can see my bicep ball up. So you think the whole muscle fiber is contracting and all the muscles fibers are working. Not the case. You actually use muscles based on demand or an all or nothing principle. So one way is load, but another way is having a really deeply keen sense of sensory perception, which is, yes, the mechanics, but also the emotions, so that we can actually maximize results in the forefront of your programming, of your physical development, so that by the time you start getting to the point of increasing loads, you have a very healthy, functional foundation that you've built for optimal mind body, mechanics, alignment, and even emotions before you start driving dysfunction into your performance.
So, Robbie, just again to build on that one more time, research shows that it takes 30,000 repetitions to create a change in higher centers of the brain. 30,000. So when you do that mental rehearsal, that actually counts as one of those reps. And so, by mentally rehearsing like where your body should be in space, we actually use that concept in professional baseball players. You can actually help a baseball pitcher change their pitching biomechanics not simply by, you got to also rehearse it, but by adding that mental rehearsal aspect.
Okay, Trent, we're going to turn to a power segment. I got 4 questions that I think are really powerful about knee. I'm going to ask you one after the other, and I'll let you give us the awesome answer that I know is coming. So here's the first.
Sure.
What are the knee problems that everyone is walking around with that they don't know that they have, that will also certainly cause problems if they're not addressed?
Yeah. If I had to put it to a problem or a root cause, let's say maybe root cause, it would be that they allow their knee to go in towards midline or in towards center line. We call it dynamic valgus.
Show us.
Yeah, absolutely. So, again, it's, and you have to forgive my video here. So if I'm standing on one leg, it's my knee doing this. Most people don't realize that their knee does this with every step that they take or when they run or something along those lines. That being said, what that movement pattern does is it wears and tears the joint. And that's why, I think there's a reason that people end up getting a total knee replacement or a total hip replacement on one side. If the body was symmetrically loaded, both hips and both knees should wear down at the same time. So because of this asymmetrical loading or not balanced loading, one side ends up breaking down more than the other side. And I think it's one of the things that leads to people having a total hip replacement or a total knee replacement. So to answer your question, knee going in towards midline.
Second question for you, buddy. Why do you think that people just accept that knee pain is something they just have to live with?
One, because I think that, when my parents grew up, that was just part of getting older. It's just a part of the life cycle. Life cycle means that you're going to have more knee pain, you're going to have more back pain. And I think that's part of a cultural change. We have learned a lot since even in the last 10, 15 years about how movement affects pain, how movement impacts loading, how it impacts dysfunction. And so, the mindset, I think, quite honestly, and even a lot of physicians still today. I mean, you've got a lot of physicians who are, in their 50s and 60s, but they're not keeping their heads in the biomechanical literature where a lot of this stuff is coming out of. And so they're not understanding the correlation of movement to the kinds of pains that they're having. So part of it is educating the medical system, but also educating people about how movement impacts their pain and the things that they're experiencing.
And last question for you, Dr. Nessler. How does someone know when they should stay off of a sore knee versus move it?
It's a little bit more complex, I think, than it needs to be. Number one is, first thing we need to know is that when you stop moving your knee, it's going to get stiff. And when it gets stiff, it's going to get sore and painful. So there are very rare occasions, usually it's after a massive injury or after an orthopedic surgery, that I am not moving somebody's knee. So, I highly encourage people to move as much as they can. Now, that doesn't mean that, let's say if you're doing, you're out running and that's bothering you, maybe you downgrade the amount of stress on your knee to allow it to accommodate and allow it to heal. So maybe you go from running on the street to doing an elliptical or doing a bike or something along those lines. That way you're still doing activity, you're still keeping your knee moving, but it's not making it worse. And how do you know? The guidelines that I use on whether someone is progressing in the right direction or progressing in the wrong direction is the frequency, intensity, and duration of your pain. If the frequency of your pain increases, that means that you're going the wrong direction. If the intensity of your pain increases, that means you're going the wrong direction. If when you irritate your knee and it takes longer and longer and longer for it to recover, that means you're going the wrong direction. Pain frequency, intensity, and duration for me has always been a key indicator on whether or not I'm progressing someone in the right direction or I'm progressing someone in the wrong direction.
That's an awesome point, which is why our fitness doctor experts, they prescribe exercise to our VIPs, especially when needed personalized. And then they always follow up. How is it going? How are you feeling? How's the pain? How's the frequency? How's the intensity? How's the duration? And one thing I wanted to go back to, because it's really important. You mentioned how important hydration is, especially as we age. It's even more important as we age because we're more exposed to getting dehydrated and dehydrated tissues.
Yep.
Just like protein, by the way, we won't get into a protein subject, but just for all of you to know, protein actually becomes more needed as we age because your body's less stimulated by leucine to go into muscle protein synthesis. So you need more protein to signal your body for keeping and developing those muscles. On hydration, the best way to know that you're hydrated is you got a pee test, right? Every time you urinate, minus the B vitamins that you might have taken, that turn
Or asparagus.
Say it again.
Or asparagus.
Or asparagus, and that also for some of us, but by the way, is genetic, will turn the urine a pungent smell. But outside of that, look at your urine and see what color it is. And you want it to stay clear-ish to a very light yellow. As you start to progress past that, you know immediately you're getting dehydrated. And the deeper the yellow and then into oranges and hope not brown, you're getting into that form of dehydration. So if you're keeping your urine towards clear to light yellow, you're staying well hydrated.
And on that, Robbie, two levels below where it should be, it's still yellowish. You have decreased healing time by almost twofold. So it has that big of an effect. People don't realize how important hydration is for, just the extensibility of tissues, the resiliency of tissues, but also those tissues to repair.
That's amazing. What valuable advice, right? 2x.
2x. Yep.
Just by changing in because we have a urine chart that we look at clear, like light yellow, moderate yellow, darker yellow, light orange, darker orange. It's basically and as you progress 2 levels in that chart, 2x difference in your recoverability. That's amazing.
For sure. So to conclude all of this, Robbie, if people were to ask me, what's the one thing I should take away from all of this? Number one, the one thing I would say is that if you're having knee pain, and you're not really clear on whether you should move it or not move it or whatever you should do, get a consult. I'm a physical therapist. I'm always going to tell you to get a consult because getting a good consult by a good therapist, like we have here at the Fitness Doctor, is going to do nothing but benefit you. Number one, they're going to help you identify a root cause. They're going to help you develop a program based off that root cause. And it's going to be the fastest route to helping you get rid of your knee pain.
You've heard it from Dr. Nessler. The number one most important thing for you to know is to take a personalized path to all of these things that we just shared with you. Lots of love to each of you. And we look forward to seeing you in our next session together.
Remember, while you're human, you are also unique. So it's important to always consider the specifics of your own body. I hope you enjoyed this video. And if you did, make sure to check out the next one right here. And you can click right here below to subscribe to our channel to get the very best content from our Fitness Doctor experts.